Aneurysms are normally treated with either observation if they're very small. So if an aneurysm is found in a patient where it's unruptured, it's found by a scan that was obtained for another reason, for example, and it's very small and is determined to have a low risk of rupture, what we will do typically is have the patient come back at regular intervals and get serial imaging. So we'll get either a CTA scan or an MRA scan, which is a MR angiography or a CT angiography. That's a reconstruction of the cerebral vessels with dye that's injected into the veins. And that can be repeated on a yearly basis or several year basis, depending on how frequently that aneurysm needs to be imaged based on its size and growth characteristics. So that's an observation management. If an aneurysm needs to be treated, in other words, it needs to be excluded from the circulation because of a high risk of rupture, there are treatment options, and those treatment options include open surgery with clipping of the aneurysm, where a small clip is placed across the neck of the aneurysm to exclude it from the circulation, or endovascular coiling with or without a stent that's placed. Now in that procedure, both procedures the patients go under anesthesia, and in the coiling procedure a catheter is threaded up through the vessels, up through the leg, and then up into the neck, and the aneurysm is catheterized. In other words, a small tiny tube is placed at the opening of the aneurysm, and then a small coil is fed into the aneurysm where it coils up inside and then is released and let go, and the coil serves to block the blood from going in, and eventually the aneurysm clots off and no longer fills with blood, and that removes the risk of rupture in the future. Now if the opening of the aneurysm or the neck is wider, the coils don't work as well because they're not held into the vessel, so what's called a stent may be placed in the vessel to hold the coils in the aneurysm itself, and this is called a stent coiling procedure. Some of the newer stents are called flow diverters, or Pipeline is one brand. There are some other brands, but these are called flow diverting stents, where the weave of the stent is much, much tighter, and it almost mimics the lining of the vessel, and that type of stent is expanded to cover the opening of the aneurysm, and then the aneurysm ends up clotting off over time and obliterating itself, so it removes it from the circulation effectively and prevents it from rupturing in the future. The other tried and true long-term treatment for aneurysms is called microsurgical clipping. And microsurgical clipping is an open surgery where an incision is made in the scalp, and we go under the base of the brain and lift the base of the brain, and under a high-powered microscope find the aneurysm and place a small microsurgical clip to occlude the neck of the aneurysm and prevent it from bleeding in the future. And that's also an extremely effective treatment to remove an aneurysm from the circulation, prevent it from pressing on nerves, and preventing it from being at risk for bleeding in the future. So these treatments can be done after an aneurysm is ruptured and cause bleeding to prevent, the patient survived, to prevent it from bleeding again in the future, or it can be done if an aneurysm is discovered before it's bled, and that gives us the opportunity to treat it before it's caused any kind of problem by releasing blood into the space around the brain, causing a hemorrhage.